And thank you for joining our first clinical webinar of 2024. Today will be a microbiome foundations, and we'll focus on your 5-step strategy, microbiome recovery, and resilience, presented by Star Edwards. Star is a registered dietitian certified in integrative and functional medical nutrition therapy with an extensive experience in patient and provider education, staff training, and content development. She initially grew interested in functional medicine while searching for the root cause and treatments for her autoimmune conditions and her son, I tried writing this out. I'm going to say EOE.
That's what most people say. You're good.
Sorry, you might be able to do a little better. I tried doing the pronunciations, but still a big word. EOE, which is a chronic inflammatory condition of the esophagus linked to environmental and food allergies. Her experience in the kitchen and as a RD helped her recreate her family's pantry and meals to accommodate their new diet-free of gluten, wheat, eggs, dairy, nuts, soy, and fish. Wow, that's a lot. Good for you, Star. Star has helped her own clients in her private dietitian practice resolve and manage conditions, including celiac disease, food sensitivities, allergies, diabetes, eating disorders, and more. She has married her experience as a WIC high-risk dietitian for the prenatal and pediatric population with functional medicine, and more specifically, the microbiome as a learning and development manager at Microbiome Labs. She currently educates, trains, and provides clinical support within Microbiome Labs and to providers with a heavy focus on the biome effects, functional microbiome analysis. She is passionate about supporting her family's health through functional medicine and teaching others how to do the same. That was a lot.
Yeah, it was.
This is fantastic. She is super knowledgeable, and I can't wait to hear what she has to say today. Star, take it away.
Thank you and welcome everyone. This is the last presentation in a 4-part series that occurred over the last few months. So if you missed the first 3 presentations over the last 4 or so months, then make sure that you let your sales rep know and they can get you those recordings, and we will be repeating the series as well. I'm going to go ahead and jump right in. We have a really simple agenda today. Our agenda is just to fix things. We're fixing the guts. We want to learn how to restore balance and resiliency to the microbiome. So we're going to start with reviewing what we have talked about over the last few presentations, really reviewing the problem. So let's start with what a healthy microbiome looks like. You're probably very familiar with this picture at this point, but a healthy microbiome has low levels of pathogens. It has a strong mucosal barrier, which is that dark blue area, strong tight junctions, and low mucosal inflammation. Now, the health of the microbiome impacts our overall health. It produces metabolites and performs functions that benefit us. It contributes to a well-functioning intestinal barrier. It supports immune regulation and a healthy inflammatory load. And it builds a more resilient environment that is less likely to experience chronic disease. So just to give you a few examples, and this is very general or generic, but our commensals, they produce metabolites that are more beneficial for us in general. So short chain fatty acids, they produce vitamins and antioxidants, neurotransmitters, and they optimize the gut pH, which we'll learn later is very important for having eubiosis or a healthy microbiome balance. While your opportunistic microbes or your pathogens, they create metabolites that aren't as beneficial for us. They can be a little bit inflammatory when they're elevated. And those are metabolites like ammonia, hydrogen sulfide, methane, and toxins and virulence factors like lipopolysaccharide or LPS. Certain dysbiosis risk factors, those are things like medications, antibiotics, stress, and the poor diet. They impact the balance of microbes in the gut. They kill off beneficial bacteria, and it allows your more opportunistic and pathogenic bacteria to flourish. And because this balance is thrown off, we have what we call dysbiosis. And this is what we see in dysbiosis, an abundance of pathogens. The mucosal layer is degraded. We have intestinal cells that are inflamed, and this results in an immune response. Now, because different types of bacteria perform different functions, this dysbiosis means that the functions being performed in the gut are also altered. So when we have less of those beneficial species, then we have less of the short chain fatty acids and the vitamins and the neurotransmitters being produced. And we have more pathogens and more of those inflammatory species who are producing more toxins like lipopolysaccharide. And this is going to impact the gut organ axis. And the gut organ axis is this multi-directional communication system between the gut and the extraintestinal organs. So it really impacts whatever is happening in the gut, and this dysbiosis is impacting all the other organs through the gut organ axis. But hope is here, and that's what we are here to discuss today. 5 steps to help you restore microbiome health and save the day when your patients experience this dysbiosis. So what are we going to do? We're going to, first of all, talk a little bit about assessment. I really wish I would have made this 6 steps instead of 5 steps, but it was getting a little bit out of hand. But we really don't know what path or what direction to go on until we know what is actually happening in the microbiome. And you would do that through an assessment. We have our BiomeFX functional microbiome analysis that really tells you what is happening in the microbiome and what has happened as a result of these dysbiosis risk factors. And of course, you want to pair that with your patient history. You want to know what dysbiosis risk factors they have been exposed to, and you want to pair it with their current symptoms and any of the questionnaires and assessment that you do. That's very important. And then the 5 steps we're going to discuss are diet, digestion, removing other dysbiosis risk factors, supporting commensals, and reducing inflammation and rebuilding the barriers. So we're going to start with diet. How does the diet impact the microbiome? And if you're curious, what is the best diet for microbial health? These are some of the characteristics of a microbiome-friendly diet. First of all, it's diverse. You'll hear me say this several times, but diversity in food in the diet means diversity in the microbiome. Different bacteria consume different types of food from our diet. So in order to have that diversity, we need to have a diverse diet. Organic, antibiotic-free sources. Pesticides will act like antibiotics within the microbiome, eliminating some of those beneficial species, as will antibiotics from food. It should be high in functional fibers, polyphenols, and antioxidants, with plenty of diversity from fruits, vegetables, legumes, whole grains, nuts and seeds, herbs and spices. So if you want to focus on what to eat more of for a healthy microbiome, this is going to be the core of what you're going to focus on. Most of these are what we call prebiotics. They feed the beneficial bacteria. So you'll want to focus on those while reducing some of these foods that will eliminate these beneficial species. Next is you want a diet that's moderate in protein and fat, and I'll give you a reference in the next slide to talk about what that means if you need a certain number, specific number, to know what it means to have a diet that's moderate in protein and fat and low in saturated fat, sugar, and processed foods. Now, these 2 categories, a high protein, high fat diet, a diet that is high in saturated fat, sugar, and processed foods, they help the more inflammatory species to thrive. So they're going to induce more of those inflammatory species and those inflammatory metabolites as a result if you include a lot of them in your diet. You want to limit alcohol intake. There's actually been some studies that show that alcohol will shift the microbiome from healthy Firmicutes and Bacteroidetes to more proteobacteria, which we know has a lot of lipopolysaccharide, which is a toxin and is really inflammatory. You want to avoid emulsifiers to maintain a healthy mucosal barrier. Some of those additives like gargum and carrageenan, they actually emulsify your mucosal layer. And consider fermented foods like kimchi, yogurt, kefir, and natto. So fermented foods can be beneficial because they contain lactic acid bacteria. These bacteria produce lactate, and that can help to decrease the acidity or the pH in the gut, and we want a mildly acidic gut. However, there are a few caveats to this, and I say it's a myth that everyone would benefit from having fermented foods. Of course, if you have an immunocompromised patient, you won't want them to have fermented foods, or if you have a patient with histamine intolerance. But there are cases when the microbiome might be too acidic and your beneficial bacteria can't live there. And it happens a lot in diarrhea, for example. So in those cases, you would want to hold off on the fermented foods until we resolve some things. And then avoid raw food if the patient is at risk for pathogens. So how do you know how your diet is impacting your microbiome? Our Biome Effects functional microbiome analysis is a great way to gauge that. And as I said before, diversity in the diet means diversity in the microbiome. And we see a Biome Effects example here of that. So this tells the total number of species. In general, having more species means that you have a better microbiome. This is the patient's healthy sample. So we like it to be around 200 at the top. And this patient has really good diversity. I would say it's like 240-ish. So this patient must have a really diverse diet, and it's showing in the total number of species they have. Of course, we want to make sure that they're the right species, because you can have a lot of the wrong species as well. So this is a good exercise for you to do. It's a good New Year's resolution. If you want to count up how many different types of food you have in a week, and include spices in that count. And you might want to just take some time later to do a little food diary and see. It might surprise you how few different foods you have in your diet. Your diet might not be quite as diverse as you think, but then set a goal for yourself to include the diversity in your diet. Add new spices, add new fruits and vegetables, add more fibers, and that will help your microbiome to have more species and become more resilient.
Hey, Star, could you
So I talk,
sorry, could you slow down just a tad? Everyone wants to hear the everything and get everything you're saying.
okay,
Thank you.
okay, yes, I will try. um, so on Biome Effects consults, we talk a lot about how we can see on Biome Effects if the patient may have a diet that's high in protein or high in fat, but you may not know for reference what that means. What is considered a high fat or protein diet? So this is for your reference. And this is by the Dietary Guidelines for Americans, saying that the percent of calories in your diet should come from carbohydrates 45 to 65%. So every day, 45 to 65% of calories should come from carbs. And I know patients are on special diets, but this is just a reference to know if it would be considered high in protein or fat or saturated fat or fiber, for example. Now, if you're looking at this label, it actually lists carbohydrates and protein and fat in grams, not calories. So you will take the grams and multiply it by 4 to get the calories from carbs. You want less than 10% of calories per day to come from sugar, and approximately 28 to 34 grams of fiber a day. That is for an adult. 10 to 35% of your calories per day from protein, 20 to 35% from fat, and you want less than 10% of calories per day to come from saturated fat. Saturated fat is the worst fat on the microbiome. And for a general reference or a general rule of thumb, I use 50% calories from carbs, 30% from protein, or 20% from fat. So you can have your patient do a food diary, use a program that automatically spits out how many grams they're having of each one of these and how many calories. Okay, prebiotics. These are the beneficial food for your commensals, for your healthy bacteria. This is what you really want to be focused on eating more of. And the definition is non-digestible food ingredients that beneficially affect the host by selectively stimulating the growth or activity of one or limited number of bacteria in the colon. So to be considered a prebiotic, it has to specifically feed those beneficial bacteria. Some examples are oligosaccharides like HMO, that's from human milk oligosaccharides. FOSs or fructooligosaccharides from foods like kiwi and banana and artichokes. Galacto-oligosaccharides from dairy products and lentils and root vegetables. And inulin from oats and garlic and chicory and leeks. A few additional ones are beta-glucans from cereals, arabinoxylans from rice and gar gum, pectins from pears and apples and oranges, and resistant starches like potatoes, plantains, legumes, and oats. This is an example of our fibers guide that we have in our BiomeFX interpretation guide. Even if you aren't currently using BiomeFX, you can have access to this. So this is in that interpretation guide, and it lists many different types of fibers and the different types of foods that fit into those categories. So I always like to provide this to patients and use it kind of like a scavenger hunt. Try to find foods or categories that you currently are including in your diet and increase those and start including more of them in your diet. If you have diversity in these fibers, then it will help you to have diversity in your microbiome. This is a summary of studies on 3 to 14-year-olds showing changes in the microbiome with increased fibers, including fructans from fruits and vegetables, almonds, galacto-oligosaccharides from cow's milk, and soluble corn flour. We can see an increase in microbial diversity just from eating soluble corn fiber for 4 weeks, and an increase in bacteria like bifidobacteria, lactobacillus, and ruminococcus, which are all good important keystone species, in just 3 to 24 weeks from changing diet alone. There weren't any other changes. What I find really interesting is that some of this population was on antibiotics. They were 3 to 6-year-olds. They were on antibiotics. And when they consumed inulin-type fructans along with those antibiotics, they noticed a stabilization of bifidobacteria. So antibiotics typically kill off those beneficial species, but when they ate fiber along with taking the antibiotics, those good beneficial bifidobacteria that produce short-chain fatty acids for us didn't decrease as much. And you probably know about the antioxidant benefits of polyphenols, but did you know that how nourishing they are to the microbiome? And I want to spend a few minutes talking about how specifically they help with microbial health. So polyphenols are compounds in plants like fruits and vegetables, cereals, tea, coffee, and wine. They are anti-inflammatory and antioxidant. They're neuroprotective, anti-diabetic. 5 to 10% of polyphenols are absorbed in the small intestine, so it's not very much. Most of them enter the large intestine undigested, and that is where the microbes will use them as a prebiotic. And in addition to being a prebiotic, they're actually antimicrobial, and this is how they help to balance out the microbiome. And by doing this, it results in increased beneficial species like bifidobacteria and lactobacillus and akkermansia, and it decreases some of those pathogens and more inflammatory species like Clostridia and Salmonella and Staphylococcus. This is a review paper that talks about the gut microbiome and diet. And I'm going to spend a few slides covering it just a little bit from this review article and specifically how different food groups changed the microbiome. Here we see a plant versus an animal protein diet. So which one is better? Well, the plant protein-based diet increased those beneficial species like bifidobacteria and lactobacillus. This resulted in an increase in short-chain fatty acid production, and improved gut barrier and Tregs. And it decreased your more inflammatory species like C. perfringens, which resulted in decreased inflammation. While the animal protein diet increased biophilia and Bacteroides, which can be a little bit more inflammatory. And as a result, we saw an increase in TMAO, which is a compound made by bacteria in our microbiome from foods of animal origin, and it's actually used as a medical indicator to predict heart attack and stroke. So the higher your TMAO, the higher your risk of heart attack and stroke. And this TMAO comes from when we eat animal protein and the bacteria in our gut break it down. We also saw decreased bifidobacterium, which is beneficial and anti-inflammatory, and this resulted in a decreased short-chain fatty acid production. Next is fat, unsaturated fat versus saturated fat. A diet that's high in unsaturated fat, so foods like olive oil and avocados and almond and fish and flaxseed, it increased lactic acid bacteria, bifidobacteria, and Akkermansia. And a diet high in saturated fat that included animal foods and then some plant foods like coconut and palm oil increased Bacteroides, bibliophilia. So it increased some of those species that are a little bit more inflammatory. Talking about diet type, the Western diet versus the Mediterranean diet. The Western diet decreased total diversity and it decreased bifidobacteria, lactobacillus, and eubacteria, which are beneficial. It increased Bacteroides and enterobacteria. And the Mediterranean diet increased total diversity, which is what we're hoping to do. It also increased bifidobacteria, lactobacillus, Prevotella, eubacteria, roseburia, and Bacteroides. So a lot of those beneficial species as well. One of the roles of the gut microbiome is the development and efficacy of the immune response. And this slide demonstrates the effects of dietary compounds on the immune system, starting with prebiotics. Prebiotics increased anti-inflammatory short-chain fatty acids and interleukin 10, while decreasing inflammatory bacterial toxins like LPS and inflammatory cytokines, while polyphenols also increased short-chain fatty acids while decreasing markers like CRP and increasing IgA. Unsaturated fatty acids decreased inflammatory LPS, while saturated fat did just the opposite. And animal protein decreased short-chain fatty acids, while pea protein increased short-chain fatty acids. Now let's look at metabolic markers. It may be no surprise to you that prebiotics or fibers decrease total and LDL cholesterol, triglycerides, and improve insulin sensitivity. But probiotics, so the actual bacteria, were also shown to decrease total cholesterol, LDL, triglycerides, while improving LDL cholesterol and insulin sensitivity levels. And we don't exactly know all the mechanisms they use to be able to do this, but they may do this in part by promoting fatty acid oxidation and reducing fatty acid synthesis in the liver. Okay, strategy number 2 is digestion. And this is my favorite tip that I have for you today. So you may be familiar with the feed and seed method, feeding or seeding with probiotics and then feeding them with the prebiotics. But if the environment is not conducive for the bacteria, they're not going to thrive there, no matter how many probiotics or bacteria you throw in there and how many prebiotics or food you send their way. They just can't thrive there if the environment is not primed for them. A big part of environment is the pH. Different bacteria live in different pHs, and digestion actually has a lot to do with the pH of the colon. The pH of the GI tract is really important. Like, as I said, different bacteria live in different pHs. And as we'll learn today, digestion is going to influence the pH at a very high level. So let's review the pH scale of the GI system. In the oral cavity, the pH is maintained near neutrality, about 6.7 to 7.3, very close to the pH in the rectum. This is important because, as we're going to learn later, if oral pathogens can make it through the digestive system alive, they can colonize the gut microbiome in the colon and increase the risk of inflammatory conditions like IBD and colorectal cancer. The stomach is quite acidic at 1.0 to 2.0 due to hydrochloric acid, which is important for digestion and eliminating pathogens. The duodenum is slightly more alkaline at about 6.1 as the pancreas secretes bicarbonate into the small intestine to neutralize the hydrochloric acid. And the jejunum and distal small intestine are about 7.1 to 7.5, so just a little higher in alkalinity. And then we get to the colon where short chain fatty acids are produced. They are acids, so they do decrease the pH a little bit, and we have 6.0 to 6.7 in the rectum. And as the pH in the mouth and rectum are similar, so is their bacterial count. And in between the oral cavity and the colon, the bacterial count increases from top to bottom, with the least amount of bacteria in the stomach, where it is the most acidic, and the most in the large intestine, where the pH is close to neutral, but just a little bit more on the acidic side. This weakly acidic pH is very important because it contributes, first of all, to microbial balance or eubiosis. It inhibits pathogens like C. diff that just can't live in an acidic environment, and it promotes the growth of commensals. It helps with absorption of vitamins, electrolytes, and iron. It activates digestive enzymes and promotes or inhibits fermentation by microbes. It also promotes the elimination of toxic substances. Now, bacteria can be categorized by the pH at which they grow the best at. Most bacteria are neutrophiles, and they grow the best at a pH within 1 or 2 units of the neutral pH of 7. The optimal pH of Akkermansia is 6.5. E. coli is about 4.5 to 9, and Bacillus subtilis at 8. Eosinophils grow optimally at a pH less than 5. They like an environment that's just a little bit more acidic. An example of this that I talk about a lot with Biome Effects is actinobacteria. It likes a pH of about 5 to 5.5. Lactobacillus at 4.5 to 6.5, and alkaphils, which like it to be just a little bit more alkaline, prefer 8 to 11. An example of this is the pathogen Pseudomonas, which grows really well at 8. Now, this is where they grow optimally at, but most of them have a wider range that they can survive in. And that is because they have adaptive mechanisms. The conditions that are faced by these microbes fluctuate rapidly, and they have adaptive mechanisms to protect them. You can think just about the process of digestion, how quickly their environment is shifting. E. coli, for example, must be able to survive exposure to the acidic pH of the stomach in order to colonize the intestinal tract. And it must be able to adapt to sudden and temporary drops in the pH. So one strategy it uses is a global stress response known as acid shock response, which results in acid tolerance and involves the induction or turning on of certain genes and the repression of others to essentially reprogram the cell. And as a result, molecules called chaperones are expressed, and these function to help fold or refold unfolded protein and allows neutrophils to survive exposure to the acidic pH. Another one that we're very familiar with are bacillus spores. They're very hardy. They can survive acidic conditions by retreating into their dormant endospore, and that's how they can also survive heat. Another example is H. pylori, which is a neutrophil and it lives in the stomach, which we saw was very acidic. But H. pylori can create a microenvironment around it, and it keeps the pH nearly neutral by doing it. It does this by producing large amounts of the enzyme urease, which breaks down urea to ammonia and carbon dioxide, and the ammonia raises the pH and makes it more alkaline so it can live there comfortably. This pH shift between the bacteria and the microbiome is very bidirectional. Microbes shift the pH by producing metabolites like short chain fatty acids or ammonia. And the pH shifts the microbes and who are living there because different bacteria grow at different pHs. So we're going to talk about how the diet influences the pH. The diet will play a role in pH shifts, as a high fiber diet will result in increased short chain fatty acid production, and that's through saccharolytic fermentation. The bacteria, usually commensals, like to consume the fiber from our diet. They ferment it and they give off byproducts like short chain fatty acids, whereas a more alkaline environment is usually created by a higher protein diet. because metabolites like ammonia and some of the other proteolytic fermentation results in a more alkaline environment. But keep in mind that proteolytic fermentation can result in saccharolytic fermentation as well, and it can result in, or proteolytic fermentation can result in short chain fatty acid production. So a high protein, high carb diet will result in a more acidic environment as we have more short chain fatty acids from saccharolytic fermentation and then more short chain fatty acids that can occur with protein. While a high protein but low carb diet will result in more alkaline environment. So if you're trying to connect some of the dots on biome effects, you may see this show up as decreased rosburia and Eubacterium rectal and lower actinobacteria because it does like it to be a little bit more acidic. So we're going to talk about how digestion can shift the microbiome or shift the pH. So primary digestion occurs in the upper digestive system and the small intestine with our mouth, with chewing. We've got stomach acid and pancreatic enzymes. The liver and gallbladder play an important role in this as well. But deficiency in any of these processes can lead to over fermentation in the large intestine. Basically, you're not digesting food appropriately in the upper digestive system. It ends up in the large intestine and it's over fermented there by bacteria, and we have too many of those metabolites as a result, and that shifts the pH. Another key factor that impacts the pH and environment of the microbiome is transit time, how long it takes food to move from the mouth into the end. So if you have long transit time, that would mean it's taking a really long time for your food to move through the digestive system, and we usually know that it more is constipation. And the opposite is when transit time is too short. It's moving through too quickly, and we usually have diarrhea. Now, this transit time impacts the substrate availability in the colon and saccharolytic versus proteolytic fermentation. When food is moving through quickly, we usually have more saccharolytic fermentation. Those carbs are easier to digest. When food is moving through very slowly, then it switches to proteolytic fermentation because it has more time to ferment and digest those proteins. Now, the long gut transit time will result in higher fecal pH and shift the microbiome from saccharolysis to proteolysis or proteolytic fermentation. And then you've got part of this bidirectional process where the metabolites that are being produced, like short chain fatty acids and secondary bile acids and your hydrogen, they will actually affect gut motility and the transit time, and then that in return will affect the pH. Here's a little schematic of the saccharolytic versus proteolytic fermentation. You've got saccharolytic fermentation. It says carbohydrate fermentation here. So carbohydrate from our diet, the bacteria take it in, ferment it, and give off byproducts like short-chain fatty acid that will result in a more acidic environment. Whereas proteolytic fermentation can happen from protein and small amounts fat as well. The bacteria take the food in from our diet, ferment it, and give off these byproducts like ammonia and sulfides that tend to be a little bit more inflammatory and increase the alkalinity in our gut. So long transit time, in other words, constipation, can result in a more alkaline environment, and that's where a lot of pathogens grow. But on the other hand, short transit time or diarrhea can result in acidic stool. So acidic stool can happen when you have pathogenic infections or overgrowth of acid-producing bacteria, lactose intolerance, bile acid malabsorption, malabsorption of carbohydrates, and I have bile acid malabsorption on there twice, I just noticed. And bile acid malabsorption can happen as a result of a high-fat diet and bile acids not being properly absorbed overproduction of bile acids by the liver, IBD, celiac disease, SIBO, and pancreatitis. So any of these conditions or situations may result in an environment that's just a little bit too acidic. Something else that can shift the microbiome are some pharmaceuticals that are metabolized in the large intestine. There's 3 categories of these that make a big difference in the microbiome: laxatives, antidiarrheals, and antibiotics. Laxatives induce diarrhea, so we would expect that it would increase acidity. Antidiarrheals slow things down, so we would expect that it would increase alkalinity. Now, this may or may not be a good thing if our patient has constipation and their environment's a little bit too alkaline, then increasing that acidity would be a good thing, and vice versa. The third category are antibiotics, because they kill short chain fatty acid producing bacteria, and this is going to result in an environment that is a little bit too alkaline, and that can really create some dysbiosis because some of your opportunistic microbes really thrive in that environment. There's also a carbose antibiotic drugs, and they have been reported to increase total short chain fatty acid production, which can increase acidity as well. Along the same line as antibiotics and pharmaceuticals is glyphosate. And in the diet section, I recommended an organic diet for a healthy microbiome, and this study is one of the reasons why. We did a study with glyphosate and Roundup where we took a healthy toddler's feces, and the feces sample was exposed to a concentration of 100 milligrams per liter of glyphosate or Roundup over a 3-week period. And then during co-treatment, Megaspore was administered at 4 billion CFU for another 3 weeks. And the results showed acidification of the gut microbial ecosystem by the glyphosate and Roundup. So we had a acidic environment in the colon by an increased production of acetate and lactate. And this shifted the microbiome to bacteria who could thrive more in that acidic environment, and it depressed the bacteria who tend to not do so well in acidic environments. So we had higher actinobacteria and lactobacilli, but we had lower Bacteroides because that acid just kind of kills them off. Now, these Bacteroides are important because they produce propionate, which was one of our short chain fatty acids, and they also produce GABA production. So we saw in the study less propionate and less GABA production. We also saw reduced alpha diversity. So the total number of species in general was decreased. Like I said, it's kind of like an antibiotic. It killed off some of those beneficial species. But the good news was that when we introduced Megaspore, we recovered propionate and alpha diversity. So if we're looking at a biome effects, we don't look at the pH on biome effects, but if you know a little microbiology, then you can get a pretty good idea from looking at biome effects if the environment is a little bit too acidic or too alkaline, especially when you compare it with the patient's symptoms. If they do have diarrhea or constipation, their health history, if they're struggling with something like SIBO. So this is an example of an environment that's a little bit too alkaline and creating some dysbiosis. First, we see decreased actinobacteria. Actinobacteria is acidophile. It likes the environment to be a little bit on the acidic side. Now, actinobacteria is where bifidobacteria is. And we think about bifidobacteria when we think about probiotics. So we know that it's helpful and we need a good level of actinobacteria. So this environment is just a little bit too alkaline for that actinobacteria to grow. We also see methane production is high. Methane will slow transit time down. So we would expect with high methane and methane producers that we're going to have longer transit time, and we're going to switch to proteolytic fermentation, which is going to result in more ammonia and a more alkaline environment. And this eukaryote is also the methane producer. So it's connected to it. But if we saw it elevated, then we would also expect to have a more alkaline environment, as well as this methano family that also produces methane. Then we see propionate production being a little bit on the high side. Propionate producers like Bacteroides are sensitive to acidic condition. So we wouldn't expect them to be doing very well if it was acidic, but if it's alkaline, they're going to do a little bit better. And then we see some of your short chain fatty acids, which are lower. Short chain fatty acids will directly create acidity in the colon. So if there aren't enough short chain fatty acids being produced, we'll have a little bit more of an alkaline environment. So why isn't it acidic enough? One reason might be a diet that's high in protein and low in carbs. I always start with diet and digestion. Many times, if you go back and look at the patient's diet, they aren't eating a lot of protein, and it comes down to digestion. Slow transit time and constipation, and low short chain fatty acid production, as well as dysbiosis. Just the fact that we have some dysbiosis here might be shifting to a more alkaline environment. So what do we do about it? A few recommendations are to decrease protein in the diet if it's elevated, and to increase carbs and fibers in the diet. Use those tools I shared as far as a microbiome friendly diet, what is considered high and low of some of these macronutrients, and all the different categories of fibers. You may want to introduce some digestive support if they don't have a lot of protein in their diet and you really think it does come down to digestion. You can use something like bitters or enzymes or even our Mega Guard. Address the methane producers. I often will recommend switching from more of an animal-based protein diet to a plant-based protein diet. And we have research that shows that Megaspore and Megapre will increase short-chain fatty acid production. So if we can get that short-chain fatty acid production going, then we can help to decrease the acidity or make it more acidic. And something else you might want to do in this case is fermented foods, because it does have those lactic acid producing bacteria. Now we're on to our third strategy, which is removing dysbiosis risk factors. We talked about a few of these, but there is a long list of dysbiosis risk factors that may impact your patient's microbiome. And those include additional prescription medications like PPIs, natural antimicrobials, even may, either those natural herbals or antimicrobials, they can impact the overall diversity. Pesticides, pathogenic infections, excessive alcohol intake, smoking, stress, lack of sleep, intense exercise, or even not getting enough exercise, lack of diversity in the diet, the standard American diet, heavy metal exposure from food and water, which is a lot more common than you think it is, and suboptimal digestive processes. So you'll want to ask your patients when you start working with them if they have been exposed to these dysbiosis risk factors and if they have the symptoms or conditions that could stem from these dysbiosis risk factors. And I also like to remind everyone not just to think about GI symptoms because of that gut organ axis. This could show up in many different forms, even if patients don't have a lot of GI symptoms. So since we've already talked about some of these, I really want to focus on two, and that's going to be stress and the oral intestinal dysbiosis. So signs of dysbiosis on BiomeFX would include having less diversity in the microbiome. That last photograph I showed that looked like this one, we saw that the patient's diversity was high. And this patient has a very low diversity, so they've been exposed to some of those dysbiosis risk factors. And whatever it is that they were exposed to or they're currently doing, we can see here that it's impacting their microbiome. In addition, their beta diversity is very low. So whereas alpha diversity, this first screenshot, is showing you how many different species, beta diversity is showing if it's the right species, if it's the good species, the species that a healthy person would have. And I like to see it from 8 to 10. So the beta diversity here is very low, which means they probably have more pathogens and inflammatory species than we would like. We would also see with dysbiosis elevated pathogens in the pathogen section and elevated proteobacteria. So where it should be at 1.5 in the dark blue, this patient has almost 4 for proteobacteria, and proteobacteria is very inflammatory and a sign of dysbiosis. Oral dysbiosis is a GI dysbiosis risk factor that we see all the time on BiomeFX. There is this bidirectional relationship between oral and GI dysbiosis seen between periodontal disease and inflammatory bowel disease, meaning that not only periodontitis increases the risk of IBD, but IBD increases the risk of periodontitis. Oral pathogens are transmitted to the gut via the GI tract, mostly when we swallow them. That one is pretty self-explanatory. We have these chemical barriers. So the stomach acid and the bile, it's our chemical barrier that should prevent these oral pathogens from making it to the colon alive. But when this barrier is broken, for some reason we don't have enough stomach acid or good bile flow, which actually stomach acid is very common not to have enough of. It can happen when we have a PPI, which is very common. It happens as we age. There's a lot of different factors that create not having enough stomach acid, and it's very important for killing off some of these pathogens. Now, if these oral pathogens can make it through that chemical barrier and end up in the colon, remember that the pH in the colon is very similar to the pH in the oral cavity. So they can actually thrive there, and they shift the microbiome to more of an inflammatory state, and it increases the risk of IBD, which increases the risk of colorectal cancer by 6 times. But how? It might be a little bit more of a mystery. How does IBD or something that's happened in the colon actually influence oral dysbiosis and periodontal disease? Gut dysbiosis triggers an intestinal immune response, which manifests as intestinal and systemic inflammation, leading to development or aggravation of periodontitis. And immune cells and inflammatory cytokines can be transferred from areas of the body to other distant organs via the blood circulation and triggers subsequent disease. So basically, we have this inflammatory process in the colon, which becomes systemic inflammation. And then in that way, it can travel to the oral cavity and increase inflammation there as well. So these are some examples of pathogens they see in oral dysbiosis and some of the ways we can see this show up on BiomeFX. BiomeFX, of course, is not diagnostic for anything happening in the oral cavity, but it does show us some clues. Some of the bacteria that we see or pathogens we see in oral dysbiosis or periodontal disease include Porphyromonas gingivalis. And in BiomeFX, we do measure the Porphyromonaceae family. Fusobacteria nucleatum is a oral pathogen. In BiomeFX, we do measure the phylum Fusobacteria. Prevotella intermedia is another oral pathogen, and in BiomeFX, we look at the Prevotella and the family Prevotellaceae. Klebsiella is known to create some oral dysbiosis, and we check for Klebsiella pneumonia on BiomeFX, and then Campylobacter species. On BiomeFX, we measure Campylobacter jejuni, which may or may not have a lot to do with oral dysbiosis, but having elevated Campylobacteria in the colon will increase the inflammation in the oral cavity. So the takeaway here is to take care of the oral cavity just as you would the gut microbiome. Avoid killing the commensals in the mouth with harsh antiseptic toothpaste and mouthwash, and practice good oral hygiene. We want to rebuild those commensals in the oral cavity just like we do in the gut, and also to pay attention to the stomach acid. I always think it's a good idea to do a quick digestive check, starting with the mouth. Are we chewing enough? Do we have enough stomach acid? Do we need enzyme support? How is bile flow? The next one is stress. We know that stress impacts the microbiome health, but I think this is another mystery. How does it do it? And I do see on BiomeFX that sometimes being under a lot of stress is enough of a dysbiosis risk factor to drop that alpha diversity and create some dysbiosis. One of the biggest ways stress affects the microbiome is by altering eating behaviors, which will directly impact the microbiome. When we're stressed, we go for the standard American diet. We're not reaching for the radishes and the asparagus. Most people will crave more of the standard American diet, which will in turn create inflammation in the gut and some dysbiosis. Additionally, stress hormones, inflammation, and the autonomic alterations due to stress reshape the microbiome, leading to dysbiosis and intestinal barrier permeability. And the heightened inflammation that accompanies stress and depression triggers blooms of pathogenic bacteria that encourage dysbiosis and leaky gut. And some bacterial species actually encourage dysregulated eating. And I've seen several research articles surrounding this and how these dysbiotic pathogens can actually control our cravings and our eating behavior. And one of the ways they do this is by producing molecules that mimic or interfere with human appetite regulating peptides and hormones. Cortisol is another one that directly impacts the gut function. We have cortisol receptors in the gut, and cortisol is released from the HPA axis and reaches the gut through circulation. And it impacts the microbiota by altering gut transit time, intestinal permeability, and nutrient availability. And this process, of course, is bidirectional too, because the gut and gut inflammation can influence the HPA axis and cortisol levels. Okay, our fourth strategy is to support commensals. And this is where Microbiome Labs really encourages this paradigm shift. So often when we're thinking about testing the microbiome and treating the microbiome, we're looking for different pathogens and parasites that we want to kill off. But one of the best strategies that we can utilize is to increase the commensals in our gut, because while we've done so much research on the microbiome, there's so much yet to be done. And it's really hard for us as humans to micromanage the bacteria and the microbes in our microbiome. If we support these commensals, then they're like our soldiers, and they will go in and fight for us and help to balance everything out and keep everything nice and healthy. So to rebuild those commensals or to support those commensals, we need three things. We need a comfortable environment, and that's going to be having a pH that is optimal for them, having few competitors, eliminating those dysbiosis risk factors. Next, we need to feed them well. And last, we can supplement to rebuild their numbers or increase metabolites and functions. If you're wanting to supplement to rebuild commensals, you're going to want to know the difference between probiotics and prebiotics. Probiotics are live microorganisms that, when administered in adequate amounts, confer a health benefit of the host, while your postbiotics are also known as paraprobiotics or ghost biotics. They are inanimate microorganisms and their components that confer a health benefit. In other words, they're like Casper, they're dead, but they're friendly. They may have some benefit for you, even though they're not alive, but once you stop giving them, they're not going to colonize the gut. Probiotics have several mechanisms by which they exert their health benefits, including colonizing the gastrointestinal tract. There's several non-specific mechanisms, including fostering colonization resistance, so just creating that competition, improving intestinal transit or helping normalize dysbiosis, and producing those beneficial metabolites like short-chain fatty acids for us, and optimizing the pH in the gut as well. There are also species-specific mechanisms. This may include vitamin synthesis, gut barrier reinforcement, bile salt metabolism, enzymatic activity, and neutralization of toxins, and strain-specific mechanisms, including cytokine production, immunomodulation, and effects on the endocrine and nervous system. You'll want to use probiotics that have been proven to colonize to boost numbers of the commensals in the gut. to exclude pathogens, and to glean their health benefits by balancing the ecosystem. An example of a probiotic is Megaspore Biotic, which is our bacillus spores. I think that most probiotics that are actually marketed aren't probiotics because they're not going to survive digestion and make it into the colon alive and colonize there, especially if they have to be refrigerated, for example. Now, Megaspore, we talked a little bit earlier about how they have this tough, hardy endospore. So the bacillus spores in Megaspore are actually very resilient because of this endospore, and they can survive through high temperatures and digestion, including the stomach acid. They colonize the gut for 21 to 28 days. While they're there, they modulate the environment and balance the microbiome by competitively excluding your pathogens and supporting other beneficial species. So as a result of the actions of Megaspore, it actually increases Akkermansia and Prosnutzi and bifidobacteria. You'll want to use postbiotics for their specific researched benefits, but know that they won't colonize. They can be beneficial for certain circumstances, but it's not going to increase the diversity of your gut. And an example of this is Pyloguard. It's our Limonolactobacillus reuteri strain that actually is a ghost biotic, but it binds to H. pylori in the stomach and removes it. But we're not administering it to colonize the gut and increase gut diversity. We're administering it to decrease H. pylori. Now, once eubiosis is reached, postbiotics may not be benefit and may not be needed, as the microbiome should be functional and productive on its own. So if whatever you're using the postbiotic for, if it's to perform a certain function or produce a certain metabolite, whenever the eubiosis is reached and your dysbiosis is resolved, your microbiome should be able to do that on its own, and it probably won't need these postbiotics anymore. Now, whether to continue probiotics, I recommend doing that as a maintenance dose, because we're going to continue to be exposed to those dysbiosis risk factors no matter how hard we try. And doing a maintenance dose of those probiotics can help us not to revert back into dysbiosis. Okay, last strategy: reduce inflammation and rebuild those barriers. After patients are exposed to dysbiosis risk factors, it not only changes who is in the gut, but it leads to barrier inflammation and degradation. You may know this as leaky gut. So now we need to go in and clean things up and do some healing. We're going to talk about reducing inflammation first. We can reduce inflammation through diet, digestion, removal of dysbiosis risk factors, and supporting commensals. So there's a lot we can do just through diet and digestion alone, and working on rebuilding these commensals and removing those dysbiosis risk factors. But if you're looking for additional supplemental support, one strategy is to use immunoglobulins. These are antibodies that bind to antigens, including pathogens, and they're toxins like LPS that create inflammation. So we're removing the source of the inflammation. You can also give supplementary bioflavonoids or polyphenols. These are antioxidant, anti-inflammatory. We do have our citrus X or citrus bioflavonoids in megamucosa. And curcumin is a very well-known one as well that's been researched in IBD. Oligosaccharides and other fibers that increase short-chain fatty acid production. They help to produce anti-inflammatory cytokines. PRMs from fish oil increase SPMs. They resolve acute inflammation in the intestinal barrier. They kind of go in like the cleanup crew. They stop it and they clean it up. And vitamin D. Vitamin D limits inflammatory pathogens and promotes an immune tolerance. So we reduce the inflammation. Now we're going to rebuild the barrier. Well, you can do a lot, again, to rebuild the barriers just by working on diet, digestion, removing dysbiosis risk factors, supporting commensals, and reducing inflammation. And for additional support, you may consider specific amino acids that are used to rebuild the mucosal layer. And this would be proline, serine, threonine, and cysteine that's in our megamucosa. It's specifically made to rebuild the mucosal layer, whereas a lot of products are focused on the intestinal barrier. Fish oil supports goblet cell abundance and tissue integrity. Oligosaccharides and other fibers increase short chain fatty acid production, which facilitates tight junction assembly. And vitamin D strengthens tight junctions and improves mucosal repair. While L-glutamine, we don't include L-glutamine in our products, they can be beneficial. It's well known for maintaining a healthy intestinal barrier. However, we use it cautiously, especially in patients that have elevated ammonia on their Biome FX, because glutamine will result in more ammonia being produced, which can be neurotoxic, and it's toxic to the liver as well. It also converts to glutamate, which is neuroexcitatory, and it can create headaches and migraines in some people. Special considerations. At Microbiome Labs, we do utilize our immunoglobulins, which is Mega IgG 2000, and that is also in our Mega Mucosa. We use those products to help with the inflammation and to rebuild the mucosal layers, but there are situations in which patients cannot have beef, since the IgG is derived from beef, but it is dairy-free. So that would be your patients that have a beef allergy, alpha-gal, who are vegetarian. And again, we can do a lot for these patients, even if they have to avoid the IgG and megamucosa through diet, digestion, removing dysbiosis risk factors, and supporting commensals. But additional support would include Megaspore Biotic to competitively exclude inflammatory pathogens, so we have less toxins that are creating inflammation. Mega Marine, the fish oil and the PRMs reduce inflammation, support goblet cell abundance, and tissue integrity. So Mega Mucosa helps to rebuild that mucosal layer, but the fish oil in Mega Marine can actually stimulate the goblet cells to produce more mucus. And Mega Pre, which has oligosaccharides that increase short chain fatty acid production, reduce inflammation, and facilitate tight junction assembly. And vitamin D to limit inflammatory pathogens and promote immune tolerance, strengthen tight junctions, and improve mucosal repair. So this is your cheat sheet for your patients who cannot do beef, have to avoid beef, and you can't use IgG and megamucosa in those patients. So that's it. And in summary, our strategy for healing the microbiome, rebuilding the resiliency in the microbiome, would be to, first of all, start with an assessment, focus on diet, digestion, removing dysbiosis risk factors, supporting commensals, and reducing inflammation and rebuilding barriers. And now I think we might have time for a few questions. We would love it if you join our next webinar in this series on how to become a microbiome expert. We'll be talking about Biome FX, and Kara will be presenting on January 24th. If you want to go ahead and sign up for that, then you can scan this QR code, and I think someone will be dropping a link to sign up or register in the chat box as well. So we have a question. What specifically does saturated fat do to harm the microbiome? So saturated fat, when we eat saturated fat, it kills off gram-negative bacteria. Gram-negative bacteria are the bacteria that contain lipopolysaccharide, or LPS. So we eat the saturated fat, it kills off these gram-negative bacteria, and as a result, they release LPS. LPS really isn't a problem until these bacteria die and they release the LPS. And then the lipopolysaccharide, or LPS, creates inflammation. It can leak in through, if we have leaky gut, for example, it can leak into systemic circulation, and then it travels all over the place, creating inflammation everywhere. We have a good one here about alkaline drinking water affecting stomach acid. That's a good question. I've also often wondered about that, and I've looked into the research a little bit, and someone out there may know something differently than me. It makes sense that it would decrease stomach acid and that would become a problem. Long term, I haven't been able to find that it makes that big of a difference. What bacteria is the one that feeds after 14 to 16 hours of intermittent fasting? That's Akkermansia, which has lots of good metabolic benefits. Is it best to separate probiotics and the megapre or megamucosa during rebuilding? There's no need to separate them. I actually think it's great to take them all together. And in our total gut restoration protocol, at the end of it, we start off with the the probiotics, and then we add megapre, and then the next month we add megamucosa. So at the end of it, you're doing all three products together. And as far as taking them throughout the day, you can take them all at one time. You don't need to space them out during the day. Can Palligard be given while on antibiotics for H. pylori? Yes, and some of the research actually they used Palligard along with the antibiotics, and it showed that it increased the efficacy of the antibiotics. Remember that's already dead. It's a ghost biotic, so the antibiotics aren't going to affect it. I think we covered some of these along the way. Any special protocols post chemo? That one is a tricky one. I would do the total gut. I would start off with a BioMFX test and then do the total gut restoration. You may need some additional IgG and fish oil as well. Which of the products can be taken by people with histamine intolerance? Most of them should be fine. Does apple cider vinegar help? It certainly can. If someone doesn't have enough stomach acid, then apple cider vinegar might be beneficial. And I think if there's questions that I didn't get to, if you can let your rep know or send those in, we'll be sure to get those answered for you. Okay. I think that's it for today. Thank you for joining us.